Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Hydrocodone. Its brand name is Zohydro ER. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find this information to be valuable, please consider leaving a like on the video, as it would really help me with the YouTube algorithm. So first, what will we cover in this presentation? We'll start by talking about how hydrocodone works. We'll then discuss indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe hydrocodone. We'll then discuss examples of dosing, and then stick around to the end where we'll talk about side effects with percentages. So how does hydrocodone work? Well, hydrocodone is a semi-synthetic opioid agonist that acts as a full agonist. The mechanism of action is due to action at the mu receptor. In terms of indications or reasons we would prescribe this medication to a patient, we would often see it used in chronic, severe pain. With respect to contraindications or reasons we would not be able to prescribe hydrocodone, we wouldn't give this medication to a patient who had a hypersensitivity to hydrocodone or to any other component of the formulation. If a patient had a gastrointestinal obstruction, they would not be able to use this medication, as well as significant respiratory depression. If a patient had acute or severe bronchial asthma, they would not be able to use this medication unless they were properly monitored. Now, what about dosing with hydrocodone? So in the treatment of chronic severe pain, we would typically see 10 milligrams orally every 12 hours, and then the patient would have the option to gradually titrate or increase the dose in increments of 10 milligrams every 12 hours every 3 to 7 days. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using hydrocodone, so I'll go over some of those here now. Up to 10% of patients may experience peripheral edema, while up to 5% may experience pruritus or itchiness. 1 to 10% may experience abdominal pain. Constipation may happen 3 to 15% of the time, while diarrhea may happen 2 to 4% of the time. Nausea may happen in 7 to 17% of patients, and vomiting may happen 3 to 6% of the time. Less than 5% may experience xerostomia or dry mouth, and 2 to 5% may experience dizziness. A headache may occur in 2 to 8% of patients, and 1 to 8% of patients may experience somnolence. A tremor may happen less than 10% of the time, anxiety may happen up to 10% of the time, and fatigue may happen 1 to 4% of the time. Now, some more rare but serious side effects would be hypotension or low blood pressure, as well as bowel obstruction. That's all we're going to talk about today with hydrocodone or Zohydro ER. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.